Welcome to this week's episode of the Blackbird Stories podcast, where each week we amplify the voices of Black women and our unique birthing experiences, creating an environment for learning, for healing, and for empowerment. I'm your host, Dr. Tiffany Woodus. Be sure and follow us on Apple Podcasts, Spotify, and YouTube so that you don't miss an episode. On this week's episode, we're joined by Toneka, who takes us on a journey of her 2 pregnancies, with the first one being very complicated, a high-risk pregnancy due to severe preeclampsia, an emergency C-section, preterm delivery, and ultimately the loss of her first child. Then we journey with her on her second pregnancy experience, where she's dealing with the dichotomy of dealing with the grief and the healing and doing the work to heal from the loss of her first child while embracing the joy of her new pregnancy journey. You don't want to miss it. I want to welcome today's guest, Mrs. Toneka. Ms. Toneka, would you mind to introduce yourself to the audience and let us know who's in your family?
Yes. Hi, everyone. I'm Toneka Rogers Robinson. I am 35 years old. We're natives of Canton, Mississippi, but have been Dallas, Texas residents for over a decade now. I'm going to detail my family in the order of age. So we have Justin, which is my now ex-husband, 19 years together, 10 years married. We have a 7-year-old pit bull. Her name is Sadie. We have a would have been 5-year-old named Justice that is in heaven. And we have a beautiful 3, almost 4-year-old named Jaira.
Thank you so much for joining us. I appreciate you spending your afternoon with us. Would you take us back to your first pregnancy? Is it something that you had planned? What was your preparation for that pregnancy?
Oh, yes. It was definitely planned. Me and my ex-husband, we had been together for about 19 years. And married since 2013. So we had been married about 7 years. So we had been married, living with each other, had a dog for a few years. And we were always the couple that said, not right now, So it just so happened to be right after my 30th birthday. And it was just a conversation one night. And he said, hey, I think if we're going to have kids, we should go ahead and have them because we're starting to get old. And so it was easy as that. We had the talk, we agreed, and we stopped preventing it. But I had been off of birth control for about 2 years at that point, but we were, practicing safe sex. I think we had the conversation in September, and it's safe to say I was pregnant. We announced in January, so we confirmed in December. So it's safe to say I was pregnant about a month and a half after that conversation.
Your body was ready. Like you, note going forward, we are very fertile. It did not take long at all to achieve that goal. Praise God. I see. That's awesome. Were there any surprises with that first trimester? What was that first part of the pregnancy like?
So not necessarily a surprise, but a hurdle that I knew I would have to deal with is I learned in 2012, once moving out here and getting a new OBGYN, that my uterus was bicornate. And so I learned early on that, if I were to become pregnant, that it would be considered high risk, and, just the details surrounding my uterus shape, and that it could, prevent growth and things of that sort. So fast forward to when I am pregnant, I had the same OB, thank goodness. He immediately just went into the normal precautions. So first trimester, I don't recall being, having morning sickness or anything. I think if it wasn't for just not having a cycle, I wouldn't have known, much. So the first few months were just standard, what I would expect. And all of the other surprises came a little later, but we were pregnant right before COVID happened. So the biggest surprise was COVID. I'm going through my first pregnancy. And of course, when everything started shutting down, the OB's office was one of them. And even though this is your husband, he's a guest. And so it was patient only. And so it changed the dynamic of, just what we envisioned for our first pregnancy.
Understandably so. And just for the audience, I want to go back to what you had described about your uterus shape, what you had learned about your body. And so a bicornuate uterus is like a cute little heart-shaped uterus. And so interesting fact, when we are developing, when we're embryos, a little heart-shaped uterus, yes, our uterus, all of us actually have a uterus that starts that way. And then as we continue to develop, this part of the heart, this part starts to go away essentially. And so eventually our uterus goes from this kind of heart-shaped uterus to the uterus that we know about. And so for whatever reason, we don't necessarily understand or know, some people don't go through the process of that tissue, that intervening tissue resolving, and they end up having a different shape to their uterus. And so just as you said, it can sometimes increase the risk for a pregnancy complication, especially if an embryo or a pregnancy implants in that area, that intervening tissue, because the blood flow, the makeup of that tissue is different from the rest of the uterus. And so sometimes having a different shape to your uterus can increase your risk for pregnancy complications, because we know that the tissue, that intervening tissue, is of a different makeup. It's made of different stuff. The blood flow to that area can be a little bit different as well. And so if a embryo that's developing implants there, sometimes you can see an increased risk for miscarriage or even preterm labor, preterm delivery. Sometimes you can see where it just constrains the area that the baby has to grow. And so you might see some growth concerns, or even where it's hard for baby to get head down in position for a vaginal delivery, just because it has less space to move around as freely. So it might increase risk for things like a C-section. But interesting that that was something that you experienced, but glad that you knew about it ahead of time. A lot of people don't learn these things about their body until they're actually trying to conceive, because there hasn't been a reason to explore, investigate, and learn these things about ourselves. I want to ask you, how did you choose your OB?
I felt very comfortable with the gynecologist that I had. And so, of course, we had to talk about family planning given the, diagnosis of my bicornuate uterus. And so, I don't think I gave any pre-thought to it, but when that time came, I felt safe under his care, because I already knew, well, for one, he looked like us. I had been with him for, I guess, 8 years at that point. And so it was just to having someone familiar that I knew my history. It made that selection very easy. I did have a neighbor that had just opened her own practice, but I still ended up going with just the familiarity and what I knew, because I knew what hospital he delivered at. I knew it was close by. And then us just not being natives of the city, just the logistics of it all, it just seemed like an easy choice.
I think that is such an important point to bring up, the fact that you felt comfortable, you felt safe with your OB-GYN. And I would gather to say that probably a lot of that had to do with the fact that you had a shared lived experience, and that he reflected your values, he looked like you, he understood your background, understood your history, and that probably made all the difference. I really think that one of the most important decisions we can make when it comes to improving our pregnancy outcome is to be very considered, very deliberate, very intentional about choosing our OB-GYN. Not just a fly-by-night decision, not just that's who was in network with my insurance, not just that's who I've always seen, that's where my family has always gone, but is this someone that I feel sees me, that I can have a conversation with, that I feel understands me and cares about my health and safety, and is going to do everything within their power to make sure that I have a good outcome on the other side. So is this someone who's going to be in the trenches with me? Is this someone who is going to consider my wishes, my desires, and make sure that I am well cared for? So I'm glad that you made such a deliberate and thoughtful choice. Yeah. So it sounds like the first trimester was easy. How was it breaking the news to your family? How did your family take it?
And so there was one little hiccup in the first trimester, but it was after my family. So I just want to note that.
Okay.
So needless to say, me and my ex-husband, we had been together since 10th and 11th grade in high school. And so, of course, our families are like so intertwined and meshed together. And it was really a shock and a celebration because, of course, 14, 15 years back, you have two young kids, they're dating, you're having sex, you're worried if, you're going to have a teen pregnancy. Are they going to, stunt their lives and things of that sort? So, of course, we had all those talks. We had all of those precautions and everything. And I feel like the older we got, they were saying like, okay, when are y'all going to give us grandchildren? When are you going to give us grandchildren? And we were in our 7th year of marriage before we decided to have kids. And so they had just resigned to the fact that we were just going to be that couple with the dog that, didn't have. Both of us have lots of nieces and nephews. We're traveling and everything. So we waited until, I think it was Martin Luther King holiday, 2020. We traveled to Mississippi, and we actually recorded telling my parents. And so we were just sitting in the living room, conversing and everything. And Justin, he grabs them and he says, guess what? Nikki's pregnant. And I think my dad said, shit, yeah, right. Sorry, like that. But you can see them kind of, like, yeah, you're pulling my leg. And we literally had to pull out the sonograms. And they looked for my name, my date of birth, and everything. And it was just like a crazy celebration. And
wow.
lots of jumping up and down. I remember after that, I drove to my sister's house. We're only like a year apart in age. But by this time, a lot of people in my family, they had their kids young. So she had 4 children by this point in time. And it was sort of like the same reaction with her. Everybody was like, can't believe it. No way, the proof. And so I had to walk around with that sonogram to prove that one day, yes. Many times I said no, and I'm not gonna have a baby. And so it was very, very exciting for the family that we did tell. But we did tell social media, and then with COVID happening, there was just like that close knit, knew, and the general public did not.
It must have been such a strange experience going through that first pregnancy in the middle of COVID. Did you feel any pushback? Did it feel more isolating? Were you okay with just having to share the experience via FaceTime? How did you cope with that?
We were already used to sort of like the isolation with being away from our family. We're about 6 hours away. And so I don't think that was the problem. It was more so just, so I expected to be in the room with him. I didn't expect to be in the room alone. So it really made it like super, super isolating. And then having to call him on the phone, it was just, normally it's like we experience it together and then like, oh, let's call our mom, let's call her dad. And then by the time you've repeated the story 3 or 4 times, they'll just know when the baby gets here or, like something happens. And so I think it really changed how many people knew and how openly we shared it because there were just so many layers of connection. Due to, just us not being able to visit, them not being able to visit, and
Tell us about the rest of the pregnancy. Were there unexpected challenges, either physically or emotionally, as you traveled through the 2nd and 3rd trimester?
Oh, okay. So things started getting rocky. I say like the end of January. So it is before I hit the 2nd trimester. The world is shutting down. I work in office. I'm a software engineer. And so I had a female boss, thank God. And so she knew that I was pregnant. And I actually just went to the restroom one day and I had some spotting. I think I either told her or I text a friend that was an OB and I said, hey, I have this spotting going on. What should I do? And I was advised to, I think it was if you soak a pad or something, a certain amount of time, then go to the ER. So I think that was the advice that I got from the OB, but I ended up telling my boss or something. And she was like, no, stop. Drop everything, go to the emergency room. So I actually went to the emergency room. I think Justin met me there, and they checked for her heartbeat and everything, and they said that everything was okay. They said that it could be, I think, implantation bleeding or that sort. But I remember the paperwork saying like threat of a miscarriage or something like that, and so. That was scary because I don't recall hearing the words from them that like something was awry. They sort of like just kind of, oh, this is normal. Things of that sort. So of course, I told my parents, I think we told like the closest people, like, "Oh, she had a little bleeding, but everything's okay." And so I think from that point in time, everybody was sort of like just on a closer watch. At that point, I think I'm going to move on to second trimester.
These are the worst mistakes Black women can make when choosing an OBGYN, assuming they'll automatically prioritize your safety, ignoring the signs when they dismiss your concerns, and not having a plan to advocate for yourself. Sis, I've been there, and that's why I'm so glad I found the Mocha Maternity Survival Guide, Choosing the Right OBGYN. This guide gave me everything I needed to avoid those mistakes, from conversation starters to tools for assessing their care. It's the ultimate roadmap to make sure you're seen, heard, and protected. Don't take chances with your health. Get your copy today and make the choice that could change everything.
Well, before you go there, let's talk about why someone might have bleeding in the first trimester. You mentioned one, implantation bleeding. That happens really early on, within the first, I would say 1 to 6 weeks of pregnancy. As the embryo is settling into the endometrium, which is the inside lining of the uterus where that baby is going to grow and the pregnancy is going to progress. Other things that can happen that are not uncommon is something called a subchorionic hematoma. And so this is an area of bleeding or inflammation that is very close to, in proximity to where the placenta is developing. And that is actually very, very common. I actually probably see that probably a handful of times each week with my first trimester patients. And it can be scary. It can be a big area of bleeding and inflammation. And what happens is our body does not like blood anywhere it's not supposed to be. And so your body is going to try to evacuate and force this area out in order to get back to like its homeostasis, its baseline. And so I even personally experienced this in the first trimester of my first pregnancy. You can have massive bleeding depending on how big this area is, like even heavier bleeding than what you'd expect with a cycle. And then some people don't have any bleeding at all. And it could be just spotting, if it's a small area. Sometimes they can be anywhere from 1 centimeter, which is like the width of a finger, even bigger in size. So that's something that not uncommonly causes bleeding. The other thing we think about is that there's so much increased blood flow to the uterus, tubes, ovaries during pregnancy that anything that rubs up against like the cervix or even, intercourse, tampons, cervical exams, anything like that that's just kind of trauma to the cervix can cause bleeding too. And one of the things that we have to do, like as physicians, is we have to kind of run down what we call a differential diagnosis, which is what are all the things that it could be? What have I done to see if it's any of those things? And a lot of times what you'll see on radiology reports is exactly that, the differential diagnosis, where they're listing it could be A, B, C, D. But I have to say that it could also be something big, bad, and scary, like a threatened miscarriage. So oftentimes any bleeding in the first trimester, we will automatically say, I cannot definitively say that this is not a threatened miscarriage. It's almost like a point of liability or to cover yourself to say, I've considered all of these things. I have done the appropriate tests and studies to make sure it's not all these things, and I've counseled the patient appropriately.
Your jogging was the hematoma.
Gotcha.
Hematoma.
Gotcha.
What they said.
That's what it was. Okay. Sorry to interrupt you.
No. Look, thank you. You're bringing all the juice.
Yeah. Yes.
So, of course, with that situation that happened with the hematoma, I'm a young, vibrant 30-year-old, first pregnancy, and then it's like, oh, you're bleeding. So everyone is like, sit down. I was a generally active person. Like, I climb on things, I go to the gym, I work out. And so it was just like that sort of added layer. Like, I already can't go out in public. I can't interact with people. Now it's like people are watching me, through the phone, stuff like that, making sure like, hope you're not lifting weights, you're not this because, quote unquote, you were bleeding, you threatened a miscarriage. And so that was definitely scary at that time. Justin drove across the road doing trucking, and the pandemic did bring on some challenges with his company. So he was gone more often than we had anticipated coming into the pregnancy. So it created a little more isolation than I was expecting and accustomed to. I think the next surprise that happened, I feel like I think it had to be in the second trimester. Um, I was, what's the word I'm looking for? Referred to the, what's it called? The
High risk OB, a perinatologist or a high risk OB?
and I'm trying to think, was it because I think I have a heart murmur in the bicoordinate uterus, and I think there were some concerns about how she was growing. She was
Okay.
measuring not as big as they wanted her to. Uh,
Okay.
then I started that extra layer of appointments with them. And every time I went to a checkup, it was like, oh, it's fine. Everything looks good. I'm sure that it was certain things that they checked for, but I can't remember at this point. And I had I had 2 instances before her delivery where I had to go to labor and delivery and get steroid shots. And I was told that those would help like boost her growth and things of that sort. But even still throughout the second, and I just hit the third when I ended up having her, it was just like the itty bittiest little bump. I didn't feel like if I sucked in, you couldn't even tell that I was pregnant. And so things felt so normal, yet I had these doctor's appointments and, these sonograms and these all of these doctors that were sort of like rallied around making sure that she had the perfect environment to grow despite the pandemic. And so it would have been refreshing to have someone sitting there with you so that I would have to recall and say, oh, I think they did this. And then if anybody questions, it was like, I have to ask them next time. And, just someone else. I have a tendency to I guess, create my own narrative. So I would have loved to have had someone that was sitting in the room with me that could hear like verbatim. And in case I, just went off a cliff and was like, oh, this must be bad. They was like, well, I didn't hear that from them. What I heard was, this, that, and the other thing. But those were the highlight of, I think, the second trimester. It was just making sure that she was okay with the specialist doctors. And there was very big needles with that. The
steroids. Yeah. You have described to the T why I encourage people to bring someone with them when they come to these doctor's appointments, because traditionally these settings, these medical practices, whether it's hospital or just a clinic, can sometimes be so intimidating and so daunting and so anxiety provoking just because you like associate this place with like hearing bad news or, pain or discomfort and that type of thing. And then you did a good job. You did your diligence in selecting an OB-GYN you felt comfortable with, but that's not always the case for some of us. So not only am I going into a scary, anxiety provoking setting, I also have to hear and sit across from someone who doesn't look like me, that doesn't make me feel comfortable, that I don't feel connected to. So I think it's so important. One of the things I tell people that they can do to prepare for these visits is to bring somebody with you. Don't go by yourself. Think of like, we have children. Think of, that kid in school whose mom is always there, whose dad is always there. They're always the chaperone. They're always reading to the kids. They're always supervising this, that, and the other. They're the head of this and the leader of that. That kid is protected. That kid has got an extra layer of protection. No one is going to mess with that child. No one is going to step to that child wrong because they know that there is an adult around that they are going to be accountable to. You know what I'm saying? And it's the same way with us as adults, right? As a physician, it's easy I'm not going to say I do this, but it's easy to dismiss one person. It's much harder to not take seriously and not slow yourself down and not listen to the concerns of when more than one person is standing in front of you. So you're fortified. You got that backup, you got that advocate who is going to go to bat for you, who knows you, who's going to remind you of, what, last week you said this, you were complaining of that, that's out of your mind. You forgot about it, but it might be critically important to your care, or just like you said, I heard it this way from my perspective. This other person heard it through a different lens. And I was able to put a better picture together and really understand what was going on and have a better understanding of the information I received. Or just, how many times have you been in a medical setting and it's so overwhelming that you don't even hear or download the majority of what you're hearing because your anxiety, your heart is racing and, you just can't focus because it's so overwhelming. So just having that person there that has your back is so, so important. So thank you for bringing up that point. In regards to the growth, when we look at like what's normal growth for a baby, what we do is we try to look at, like, for example, in the second trimester, let's say you were 24 weeks. So what we do is we look at all babies that are 24 weeks and we basically average what those babies weigh to come up with a standard curve. Right. And so we say that 50% of babies, normal weight babies, should fall in this weight range for 24 weeks. And so your normal range is going to be anywhere from the 10th percentile to the 90th percentile on this bell curve. But you really want to be at the 50th percentile. So if someone starts falling off the growth curve, either not gaining enough weight or gaining too much weight, you want to watch and make sure that there's not something going on that you haven't identified that might be harmful to their health or well-being, that might show up as their weight falling off, right? Is baby getting enough nutrients? Is there an issue going on with the placenta? Is something else going on that's maybe slowing down or impeding the growth, especially if someone or if a baby was growing appropriately and then all of a sudden you see this big change? Has there been an insult? Has something happened that potentially could compromise baby's health and well-being? And then you want to start, like you mentioned with the high-risk OB, following markers of development and health and well-being to see, what's going on? Is baby in distress? Do we need to offer some assistance? Does this mean that there might be an increased risk for a bad outcome? Is there anything I can do to help to improve my outcomes? Maybe deliver early, or like you mentioned, steroids.
Think about it. How many hands helped raise you? How many voices spoke life over you? How many arms held you close? Black family is deep, and at Melanin Maternity, we celebrate every single part of it. We're not just a shop for mamas. We're a love letter to the entire village. From keepsake birth announcements that honor your newest blessing, to new dad gifts, to presents for the grandma who still prays over you, we have gifts that tell your family's story. Looking for holiday gear that actually represents us? We got that too. Because whether you're the one having the baby or the one making sure the baby always has love, you deserve to be celebrated. Shop Melanin Maternity on Etsy today by visiting melaninmaternity.etsy.com, because our families, our stories, and our legacies deserve the spotlight.
Steroids is one of the interventions that we often consider, because one of the reasons we give steroids is because we know that it can help accelerate fetal lung development. So baby's lungs, we think, develop around 34 weeks. And, we say 34 weeks, but we know that if a baby were born that early, would still have some difficulties potentially with breathing and might need some support. But studies have shown us that when babies are given steroids, typically it's 2 doses of steroids over a set period of time, that we can accelerate or speed up lung development. So we can decrease any breathing or respiratory difficulties that they might experience after delivery. And so when I'm thinking about doing this, I'm thinking something's going on. I may not have the answer. I may not know what that something is, but I think that whatever is going on might increase my risk for preterm labor. So what can I do in order to help improve my outcomes? And steroids is a good option. Not only do they help with lung development, but they also decrease risk of infection. So babies' immune systems are not as developed, not as robust and strong as ours. And so by giving steroids, we can decrease their risk for infection. It will also help to decrease their risk for bleeding. So their blood vessels are so tiny, so delicate, so sensitive that you could see an increased risk for bleeding in the brain, an increased risk for bleeding in the gut. So it will help to decrease those things and will also help to decrease feeding difficulties. So those are like the 4 big categories we think about when it comes to prematurity. And we have good research to show us that those steroids, when mom is pregnant and she's at high risk for preterm labor and delivery, will help to decrease our risk for those complications.
Yes. Like, ugh, okay. Hard to
I got you.
But my OB, Dr. Blair, like he was just so comforting. I'm trying to jog my memory. Did he even tell me that? It's like he said it in such a way. Of course, now I know hindsight looking back. Thank God for the steroid shot. But I think the way he, packaged it was, like, we're gonna give her a little boost. We're going to, and so that I think, and I can't say that he didn't tell me, but of course it was a lot that we're doing to prepare for preterm labor, because that is going to be my end. My blood pressure was fine, like every checkup I went to, although we had all these extra layers of precaution, I checked out each time. And so it was like, here's this normal pregnancy, like say vitamins or extra check, like extra knee pads, so to speak.
Right. Take us into the third trimester.
I will have to take you to 27.5 because
Okay.
that's everything ended.
Okay.
It was I think it was just a normal checkup.
Okay.
I went in, maybe it was a 27-week checkup or something. I don't know. I don't know like the benchmarks. If it's and I felt fine. I recalled the day before I went walking with the dog at the Cedar Ridge Preserve. It's a hot May day coming up on Memorial Day. It's fine. So out of town. So I'm just going my standard, process, get into the office, call him when I'm back in the room and everything. And the nurse is taking my blood pressure, and she takes it and she says, "Oh, it's a little high. Let me take it again." And she takes it again, and then she says, "I'm gonna go talk to the doctor. I'll be right back." And so I'm kind of sitting there like, and they say, "We're gonna wait a minute," like they tell you, you put your feet flat, do this, drink some water. And she takes it a third time, and she's like, "Your blood pressure is high." And she says, like, "Are you having any headaches? Have you been feeling okay?" And I detailed to her like what I did, the previous day before. Of course, in software engineering, is we're at the house. There's like a layer of stress that's added to that already. Nothing that I hadn't, nothing that was different from the past 2 or 3 months. So I was just like, no, I feel fine. And so Dr. Blair comes in, and by the time he comes in, he says, "Let me check your blood pressure one more time. It's a little high and it's normal." And this is where, like, hey, I take my hat off to him. He says, "Yeah, your blood pressure's never been that high. So what I'm going to do is I'm going to send you to labor and delivery." And at this point, this was my third time being there because thank goodness, well, in hindsight, I had gotten the 2 steroid shots there. And while they're there, like they monitor the baby, make sure you're fine and stuff like that. So it's always like at least a 2-hour ordeal. He said, "I'm gonna send you there, get some tests, let them check you. I just want to double, triple check that baby's okay." And so I'm like, okay, got it, no problem. Text my boss and tell her, "Hey, I'm gonna be a little bit longer because I gotta go to the hospital, do some monitoring. I feel like everything will be okay." That was May 27th. I did not come out of that hospital until June 1st. But I get there. They hook me up to the machine. The baby's fine, heart beating, everything is great. They take my blood pressure there. It's fine. They call Dr. Blair, and these are just things that like I remember that made me feel safe. Like I could like hear his voice on the other side of the phone. Like they didn't walk out the room to make the call or just come back and tell me what he said. And they were like, "Okay." They say, "Hey, we've done all the standard checks, she's fine, the baby's fine, should we let her go?" And I recall him telling them to run some type of panel. And so they drew some extra blood, and they came back and they told me that my liver enzymes were like 4 or 5 times what they should have been.
Oh, wow.
Didn't tell me it was HELLP syndrome at that time, but they were just like, "We're gonna have to put you on some medication to bring something down," because they said it was gonna affect my heart. And at this point, like, okay, I'm getting kind of scared. So I called Justin, and he was coming back from Wisconsin. I kid you not. And I think he was somewhere in the Midwest at that point. But they said, "We're going to give you," I think it was magnesium, and please correct me if I'm wrong or something like that.
You're correct. You're right.
That entailed was I was going to have to get a catheter. I couldn't walk. I was going to have to be bedridden for 24 hours. And then they were going to have to do some urine protein test or something. It went down because that would be an indicator. And then I would have next steps at that point. So I'm sort of like, okay, I don't know what's going on. They had already told me before they administered the medication that it was sort of going to have me out of my mind. Like I was going to be under the influence of whatever this medicine was. And that's why I was going to have to stay in bed and couldn't walk and would have to have the catheter. So there was sort of like this rush to kind of call parents and, say, "Oh, this is what's going on." But even still, like they were just like, "Oh, this happens. You take this medicine for 24 hours, you do the test, it normally works, you go back home, we monitor you, And so I just recall telling everybody like, "Oh, I'm just here for 24 hours. Everything's going to be fine. I'm going to take the test and the test is going to be fine because I walked into that doctor's office today and I was fine. I came
Right.
to the hospital today and they checked my blood pressure and it was fine. My little baby has to bake. I don't have her until August 13th. Like this, no, August 23rd. So
Mm-hmm.
it's May 27th. It's not time yet. And so Justin's trying to get back down. We turn into the next day and we're at like the 24-hour mark. And so I do recall about that day, my parents calling that morning and they were saying, baby, should we come? You know, like just say the word and we'll get on the road.
Mm-hmm.
And I think I was high at this point, but
Mm-hmm.
I was like, no, I think I feel fine. Everything's gonna be fine. I still had all the best wishes in my head. And it was about 6:30 next day. And I think that it hit the 24-hour mark. And so they were like, okay, we're going to take your urine. We're going to go run the test. And we'll let Dr. Blair know. We'll come back in. And if everything's good, you can go home tonight. And so it was about 8:30 when they came back in. And by this time, Justin is in Arkansas.
He's booking it. He's booking it. Yeah. Yeah.
They come in and no, it wasn't Dr. Blair, but it was his nurse. She came in and she said, Dr. Blair said, we're going to have to take the baby. And I think he was on the phone. He was on the phone. So she had him on the phone. I had Justin on the phone and he said, we're going to have to take the baby. I mean, it's not looking good. You know, she has a better, chance, you know, they're going to bring in some paperwork. And it was like just all like crashing in at once.
And you were there by yourself.
There by myself.
Oh.
And so Justin was on speaker. I recall, I think I just started screaming. And I remember the nurse took the phone and she was talking to him. And of course, he had to call everybody. And they were saying, I think he asked the nurse to ask Dr. Blair if he could hold on to the last minute because he's about 5 hours out at the Dr. Blair says, okay, I'm going to try and wait. I think 8:30 turns into 9:30 and he says to your husband, if he's not here by 10:30, we have to take her. And by this time, I think he is, he's outside of Houston or something. Geographically, that doesn't make sense. But I think what was going on, we were hoping for the best. So his landing place was in Houston. So he was going to, you know, get to Houston, hand it off to his father and catch a flight to Dallas.
Got you.
Or instead of, you know, just throw because he has millions of dollars that need to be delivered somewhere. So it's like, you're the boss. You still have to like make sure everything is in alignment. And so according to 10 o'clock, everything drops. He realizes that he's not going to make it until 11:30. That's what his GPS said. And Dr. Blair says we have to go on. In the midst of all of that commotion, Justin calls me and he says, okay, they said that you can bring somebody in for the delivery, of course, because that's extenuating circumstances. They said, who do you want? And his sister was available and one of my best friends was available. And this is crazy because my sister-in-law, she has a child, an adult child. She's been through childbirth. She knows what everything's like. My best friend still doesn't have children. But what mattered to me in that moment was peace and somebody that would not stress me out anymore because my whole world has been like turned upside down. And this is my husband's sister. I've been around her for 17 years at this point. Yeah. If a doctor looked at me the wrong way, she would probably punch them, you know? And so despite the medication I was on, I remember saying, not her, because she's going to drive my blood pressure up more. Give me this person that's never done anything because I was caring more about my emotional and mental well-being. And so in hindsight, she called her mom and she was like, Nikki wants me to come and they're going to deliver the baby. And so like her mom is coaching her while she's on the way to the hospital to be. She is there. They scrub her in there. It was so emergent. Like, I don't remember them shaving. They had to, they said, we're just going to clean you and we're going to do this, sign this. And they wheel me back into the room. And I talked to her the whole time, like they're cutting. And I don't know how I remember this, but it's like I could, of course they gave me a spinal tap, so I couldn't feel any of that. But I could feel like the tugging. Right. And looking up at the lights and I see like little reflections off the metal part, you know, like it's just red and blood and guts and everything. And, you know, it's very sterile in there. And she's like, what are you looking at? And I said, I think I see my intestines. I'm tugging on me. Like, does it hurt? I said, nothing. below.
Mhm.
I said, but I smelled him cauterizing. Dr. Blair tells her to get her. I think Justin's on. He didn't want to FaceTime because he's driving. So he told her to like call. So he's on speaker, and Dr. Blair's just like talking to us, and he's saying something about some show that's on TV, just like real small talk, kinda. And he was like, "Do we have Dad on the phone?" And he's like, "Yeah." And he was like, okay, I'm about to take her out. Do you want to see? And me and my friend, we laughed and we say, no, he can't see the blood. Like, we need him to get safely. So let's just let him listen. Okay. He says 22:30. I think he used like military time. But she was born right at 10:30.
Wow.
And there was this itty bitty cry. Like once he said 10:30, I said on the dot, and you hear,
Oh.
she's crying. And I just remember like, okay, she's alive. And he holds her up over the little paper, and I see her tiny little body, and she's just feisty. She's just like crying. Like, she doesn't have a name. I had 12 weeks to go.
Exactly. You thought you had more time.
I knew she was a girl. This was I don't know. I remember them taking her over, and you hear them. They're like checking her and analyzing her and all this stuff like that. They're like sewing me up and kind of talking or whatever. And so they say that she's breathing really well. So despite how small she is, they tell me she's a pound, 8.3 ounces. Whoa. But she's like fussing the whole time. So I think they put the little tubes and stuff on her. They tell me that she's breathing only 2% less than what we need to breathe. So like they said, we don't need to intubate, like they just put a little breathing tube on her nose. And, like you see her when they were wheeling her out. And when she left that room, like, things were looking good, Of course, when I'm signing all of the paperwork, they had to come and tell me, okay, if it goes good, this is how it'll look. If it goes bad, this is how it'll look. And so, as far as giving that experience under the circumstances, I felt like, hey, this is as good as it, is going to get. She came out crying, her little voice. They don't have to stick a tube down her throat. These next 24 hours are going to be critical. They let me sit there and see her because they told me ahead of time that I couldn't go to the NICU until I was weaned off of the medication. And so it was safe to say that I wasn't going to see her until she was like a day old.
Gotcha.
Okay.
Ooh, that was a lot. Deep breath.
Here.
Goodness.
That was a lot.
That was a lot. That was a lot. When did Justin make it?
Justin made it, I think it was right before midnight. So he did make it that day. And they allowed him to go to the NICU. And he took a video of her. Of course, at that time, he couldn't touch her or anything. But like she was still just fussing, and she didn't like getting her temperature checked. And like we have to have her, like they had her like in a little splint. They were like, they had to keep her midline, I think the term was. Until she got a brain scan because of the bleeding and how young she is. But they were saying like her vitals were good. They didn't need to, do anything more than what, I had been let in on. And it was just like, I think it was, let's see how the 24 hours are. And then there was something I remember about a brain scan that would tell us, where we were with things.
That concludes part 1 of Toneka's birth story. Be sure to join us next week to hear how her story unfolds. Thank you for tuning in. Be sure to share this episode. See you next week.
Want to go deeper? The conversation doesn't have to stop here. Join Melanin Maternity, our digital Black birth community, where you'll get expert guidance, real support, and a sisterhood that sees you. From live Q&As with birth experts to empowering discussions with other Black mamas, we've got you covered. Click the link in the description and step into the community you deserve.